Hello, I'm Dr. Paul Bekkum. Welcome to our podcast. We're hoping that you are looking for extraordinary health. Today's topic is going to be on diabetes. First of all, I'm just going to kind of go over the different types of diabetes. You have type 1 diabetes, which type 1 diabetes is something typically you would get as a child. My wife, however, is a little bit on the odd side here. She was 46 years old when she got diagnosed with type 1 diabetes. Then there's also type 2 diabetes. Typically, some people call it sugar diabetes. It is something where their pancreas isn't responding well to the carbohydrates that you're eating, and they become very insensitive because you have so much sugar coming into your system that they just can't even respond well anymore. So that's how you get type 2 diabetes. But there's something that even happens before that. There's something that's called prediabetes, or you can also have metabolic syndrome. Both of those can turn into type 2 diabetes if you don't do something about it and get it reversed before you slip into full-on type 2 diabetes. I think here's just something for you to really know about this. Some of the complicating factors here, whether you have type 1 or type 2 diabetes, is that you can literally have cardiovascular disease. You're going to be at a much, much higher risk of getting cardiovascular disease, hypertension, retinopathy, which is a disease where the retina on the backside of your eye starts to get affected, especially because of the increased blood sugar levels. And a lot of people that do have diabetes will start to notice visual problems when their blood sugar levels start to spike. You'll also start to run into kidney disease because your body is just having a harder time trying to clear that sugar out of your system. And typically, you're even going to start to drink a little bit more as far as drinking more water because your body wants to try and dilute it down and get rid of it. The next big complication is neuropathy. We see a lot of people in the office with neuropathy, and the vast majority of them, it is because they have diabetic neuropathy. There are other forms of it, but diabetes, it's when you have those high blood sugar levels, it starts to affect the circulation in the smallest arterioles in your body, which typically are in your feet and in your hands. And you're literally going to end up, having the blood flow almost stop. People will start to have bluish to even purple looking hands and feet. Worst case scenario, then when the circulation starts to get really bad, they're going to get ulcers. And then that's where, kind of the next complication kind of comes in, and that's amputations. If you let this go too far, you're looking at, having parts of your body amputated because the blood flow is not getting to the tissues and it's dying. And especially if you're walking around your house, if you're walking around your house and you have diabetes or neuropathy going on, you need to make sure that you have some kind of protective footwear on your feet, because if you're not going to do that, you definitely need to be checking your feet every single day, because you don't want to get a cut on there, because as soon as you get a cut, that can get infected again without having really good blood flow there. All of a sudden now it gets gangrenous and you start to develop, ulcers, and that's where you end up, going down the road of having to have things amputated. Another complication is that you'll get periodontal disease, and that starts to affect the blood flow, that's going to the tissues around your teeth, and you can start to lose teeth because of it. You're also going to get pain because the blood sugar levels that start to build up in your body start to affect the nerves as well. And it's just like an acid almost on the nerves. And that's where some of the patients with neuropathy, once things get really bad, they can't even sleep really well at night, because even just the weight of the sheets on their, their feet or in their hands is uncomfortable. So they have to pull them off. Again, that's just, another whole host of problems there. You have bad circulation there anyway. Hopefully it's just not that cold in your house, but you're literally going to have just worsening problems with this. And then this can lead to the next complication, which is depression, because you just see things kind of almost rapidly, unfolding in front of you here with all these different complications that are, In the case of like type 2 diabetes, I mean, these are some things that if you really stick to it, we can get it reversed through exercise, diet, and nutrition, but you got to get ahead of it before it gets to be too bad. Because if you're not getting it under control, it's going to be hard to get it reversed for you there. The other thing that can end up happening here is you can start to develop autoimmune disease because, once your body, starts to have those blood sugars out there and, if the nerves are getting kind of mixed signals, your body starts to even form different chemicals and all that there in your body. And it can kind of confuse those for, an invading, organism, virus, whatever it is. And your body starts to kind of fight against itself there. And again, that just starts that downward spiral here. And again, we want to stop it before it even gets that far. So what do you really need to do? I mean, what you should do is get tested just to find out exactly where you're at. That's why you should even be having, your annual physical every year and be getting some lab work done with it so you can determine if you're already starting to get some of these pre-diabetic type situations or you're starting to get metabolic syndrome. Let's start to take action at that point and start to get things, straightened out. Let's get you on an exercise program. Let's look at what you're eating as far as for your diet. Most people are eating, just far too many, I would say simple sugars here. So like the white sugars, the white breads, white rice. These are just highly refined carbohydrates that are just going to spike your blood sugars out. And you're going to end up, just having, problems with diabetes coming down the road. So we need to stop that. We need to start to get you to eat things that are a little bit more colorful. And from the Institute for Functional Medicine, they'll say that you want to eat a rainbow of colors and not the sugary kind. We're talking about rainbow colors of fruits and vegetables. More vegetables and fruits because fruits do have sugars in them. And, that is just not going to be something you really want to do here. Because you're already dealing with blood sugar issues here. So you don't want to be eating anything else that could be possibly raising your blood sugar levels a little bit at a time to things that have higher fiber content. You might want to go with like prunes, which seems, they have a really good antioxidants in them, which you're going to need anyway. On the vegetable side, kale would be another one. So, another big thing that could be super helpful if you're already into having, blood sugar issues here, or you just really want to monitor yourself, is to literally get a continuous blood glucose monitor. And what that can tell you is you can even then see how different foods that you eat are causing your blood sugar levels to spike out. So typically after a meal, your blood sugars are going to spike up. They might even go up to 180, over 200, might even go higher than that, depending on what kind of foods that you're eating. But you should see within 2 hours that it's dropped down, more down into the range of about 140 to 160. And your body should see it even drop lower than that, especially at night. You shouldn't be eating foods within 2 hours of bedtime because that's going to keep that blood sugar levels up. Your body isn't meant to rest and, sleeping at night. It needs to be able to rest, completely recover from everything here. You don't want to have it trying to work on digesting foods while you're sleeping at night. This is just going to set you up for metabolic syndrome or pre-diabetic situations here. So, one thing you just need to kind of remember is that you need to be proactive when you start to see any kind of numbers that are getting out of the ordinary here. And you can contact our office. We can get you set up. We can get you tested, doing like a metabolic panel. We could do even a glucose tolerance test. We might even want to test other things like vitamin D levels has been correlated with diabetes, vitamin E, essential fatty acids. And some people, they might even had some exposure to some chemicals. We have some questionnaires that will help us determine exactly what we want to get tested here. One's called the Medical Symptoms Questionnaire. And for me, it just helps me see exactly, what areas that you're having issues with here so that we can kind of choose the most appropriate test to get done for you. Some of you, there's another questionnaire called the Toxic Exposure Questionnaire. Farmers are around all these chemicals that, are toxic. And even people that live in town. We live in the plains in Fargo, North Dakota, and there's winds that kick up and they're blowing dust and dirt around that has all those pesticides, herbicides, all that kind of stuff in it, fertilizers, and people are breathing that in. I mean, is there, everybody's different when it gets to that, toxic load and what they can handle too. So by filling out these questionnaires, it'll help us determine which of these tests might be the most appropriate thing for you to do, because we can see how well all the different body systems in your body are working or not working. So if we do find that we can help you, we're going to let you know that. And a lot of the things you're going to be able to do here are going to be through your diet. And just, I shouldn't say that, it should be through lifestyle. And diet would happen to be one of them. So again, like we talked about before here, eating, foods that are more on the high complex carbohydrate, but I would say you're going to want to shoot for a little bit more high protein, good quality fats. I mean, you want to stay away from the nitrates. I mean, things like bacon and any, processed meat, beef jerky, sausages, summer sausage, all those kinds of things like that, because those have an increased risk of driving more metabolic syndrome, which can turn into type 2 diabetes. So again, getting the proper amount of sleep. You want to get enough sleep, but you don't want to get too much sleep either. That's where it's like anything, anything in moderation is good. If you get too much of it, it's not good. Not enough of it, it's not good either. Or maybe some things you can just completely avoid, things like alcohol. But sleep and relaxation, should be getting about 7 to 8 hours of sleep a night here so that you're sleeping really well. If you really want to find out about how well you're sleeping, you can even get into different things that can track that. I use an Oura ring that seems to be very, very accurate. I mean, it might not be a university, health study quality there, but I think it gives me pretty good information. It seems to be pretty consistent for me, and I definitely do feel better when this does give me those higher scores. I mean, as far as it does correlate with me feeling better. You can use a watch. I mean, Apple Watches have some sleep tracking on them. There's lots of devices out there that you can get that can help track that. So sleep and relaxation, even getting into some meditation type things. The other big thing is to look at, we already talked about, diet a little bit here, nutrition. Let me just kind of cover some things here. I mean, with diabetes, it's kind of all across the board, because depending on where you're at, whether you're at a pre-diabetic or metabolic syndrome type situation, or type 2, or you're type 1, and of all those different complicating factors, there's going to be different things that we're going to need to do to address some of those things. For sure, one of the things that we use, like with our patients with neuropathy, is alpha lipoic acid. That you can start off with at about a 600 milligram dose, but if it's more on that severe end of the spectrum, we might have to get it up to about 1800 until the symptoms start to go away, and then we'll back it back down into that 600 range. Definitely you're going to want to be on a high potency multivitamin, multi-mineral, just to help cover all your bases there. A methylated, B complex, so that way you're getting those B vitamins absorbed. Again, it's kind of back and forth with some of the studies as whether taking it long term is beneficial or causes any other problems. It's not really known specifically at this time, but definitely getting on them, because you're going to need things methylated out of your system here, especially when it gets to some of the blood sugar issues. Using about 1 to 3 grams of essential fatty acids a day, or fish oils. You need all that to help form all the hormones in your body. It's going to help out with all the cell layers, the cell walls need the essential fatty acids there. Another thing is to get 1 gram of protein per pound of body weight, which could be a lot. If you weigh 200 pounds, that means you need to get about 200 grams of protein in. Like about a 12-ounce T-bone steak is 75 grams. So you're going to have to eat like almost 3 of those in a day. That might be out of people's price ranges. So you could do things where, eggs are going to be helpful. Any kind of protein source, the source that you like. Again, trying to get it as close to an organic state as possible, so you're not getting all those extra toxic loads to your body there. And if you have to, using a protein powder, or you could even get an amino acid powder, just to make sure that you have all the essential amino acids in your body, so that your body can form all the proper hormones and repair tissues and all that sort of stuff. And an antioxidant on top of that. So again, you can get into the vitamin E, A, D, E, K, vitamin C, selenium. I mean, just a good antioxidant can be super helpful in making sure that your body isn't getting oxidized here at all. Also starting to exercise, getting at least probably, around the order of about 120 minutes of exercise per week. Some range from like 90 up to 150, but I think if you stay about that 120, you should be in good shape. And that's just something as simple as getting out and just going for a walk. Try and make sure you're breathing a little bit harder as you're doing some of these things. So get up to a pace where you can still probably, if you're walking with somebody, talk to them, but it should be at that edge of you're starting to kind of lose your breath a little bit there. And then any stress that you have in your life, just making sure that you're dealing with it in a healthy way. Make sure you have, as you're doing all these things, these are all what are called eustresses. They're good stresses on your system. We're trying to give your body everything it needs to help build and repair itself here. But if there's some stressful situations in your life, you might need to take an inventory of those and, sit down and look at how you might need to deal with each of those individual situations. Also make sure, relationship wise, you're having good, healthy relationships, and just make sure it's not on a situation where it's a negative or unsupportive type situation. And all those are going to need individual looks at, but just make sure that you're taking your time and, going through these things. You're going to need probably a journal to write stuff down and to make sure that you're keeping track of this stuff, because as you change things, you're going to probably see certain things make a big difference and other things might not. So I know that was a lot of information in a very short period of time, but I hope that was beneficial to you. Just keep on listening here. If you have any questions or concerns, or want to set up a complimentary consultation in the office right now, you can do that just by calling 701-356-0016 and getting that set up, and we can start to help you out and see where you need to go from there, and let you know what we might need to do to get you moving forward, to get you finally feeling good and living your full potential.